Welcome, everyone. Today, we're delving into the intricate realm of somatic symptom and related disorders. These disorders encapsulate a spectrum of conditions marked by persistent physical symptoms that defy complete explanation through medical means. While they were formerly categorized as somatoform disorders, they now find their place under the broader diagnostic umbrella of somatic symptom and related disorders within the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, DSM-5. Throughout this presentation, we'll offer a thorough exploration touching upon key features, diagnostic criteria, and treatment strategies for these intricate and often perplexing clinical presentations. Let's embark on this journey together. Somatic symptom disorder presents a complex diagnostic challenge, primarily as it's a diagnosis of exclusion. Individuals grappling with this disorder endure persistent physical symptoms that elude medical explanation. These symptoms often appear disproportionate to any identifiable pathology, leading patients on a frustrating quest for answers, marked by frequent healthcare visits. The gamut of physical complaints associated with somatic symptom disorder is vast, spanning cardiac, neurological, pain, and gastrointestinal symptoms. Despite normal medical test results, patients grapple with excessive worry, anxiety, and depression intertwined with their physical experiences. For a formal diagnosis, these persistent physical symptoms must persist for a minimum of 6 months, coupled with a notable degree of distress, preoccupation, and maladaptive behaviors revolving around these symptoms. Treatment strategies for somatic symptom disorder pivot heavily towards psychotherapy, particularly cognitive behavioral therapy, CBT, or psychodynamic therapy. These therapeutic modalities aim to unravel the intricate web of psychological factors underpinning the persistent physical symptoms, fostering a path towards understanding and healing. Conversion disorder, historically termed as hysteria, presents a perplexing clinical picture characterized by neurological symptoms devoid of clear medical explanation. Manifestations such as blindness, numbness, or paralysis emerge abruptly, often appearing disproportionate to any discernible underlying causes. The neurological symptoms hallmarking conversion disorder encompass a broad spectrum, spanning from blindness to numbness, paralysis, psychogenic non-epileptic seizures, fainting, and issues with gait and coordination. Crucially, these symptoms lack attribution to any known neurological condition, adding layers of complexity to diagnosis and treatment. Management of conversion disorder typically adopts a multifaceted approach, integrating elements of physical therapy, psychoeducation, and supportive interventions. The overarching goal is twofold: to address the underlying psychological factors intricately intertwined with the neurological symptoms and to facilitate the patient's journey towards recovery and functional restoration. This holistic approach aims to bridge the gap between mind and body, fostering a pathway towards healing and improved quality of life. Factitious disorder imposed on self, colloquially known as Munchausen syndrome, delves into a realm where individuals simulate or produce physical or psychological symptoms, assuming the sick role to garner attention or access medical care. Unlike other disorders motivated by external rewards, such as financial gain or avoidance of responsibility, individuals with Munchausen syndrome are driven by an intrinsic desire to embody the role of a patient. The lengths to which patients with Munchausen syndrome may go to fabricate or induce symptoms are staggering. From contaminating urine samples with blood or feces to mimicking medical conditions through medication, their actions are often elaborate and calculated. Skilled at presenting their symptoms in a compelling manner, these individuals navigate a cycle of repeated hospitalizations and medical interventions with alarming adeptness. Managing Munchausen syndrome demands a comprehensive, multidisciplinary approach. Psychotherapy, particularly cognitive behavioral therapy, stands as a cornerstone, aiming to unravel the complex psychological underpinnings propelling the behavior. In some cases, selective serotonin reuptake inhibitors, SSRIs, may be prescribed to address underlying mood disorders. It's imperative for clinicians to navigate this terrain with caution, as Munchausen syndrome can evoke intense emotional responses, potentially blurring professional boundaries. Awareness of countertransference is paramount, ensuring that healthcare providers maintain a balanced perspective while delivering care and support to individuals grappling with this challenging disorder. Munchausen syndrome by proxy, also termed factitious disorder imposed on another, unveils a harrowing form of medical child abuse where a caregiver, typically a mother, orchestrates the fabrication or induction of symptoms in a child. The motive behind such manipulation is often a quest for attention, sympathy, or the coveted patient role for themselves. Distinguished from Munchausen syndrome by its gravity, Munchausen syndrome by proxy entails the exploitation and potential harm of a vulnerable child rather than self-inflicted symptoms on the part of the caregiver. Addressing and combating Munchausen syndrome by proxy necessitates a collaborative, multidisciplinary approach. Healthcare providers, social workers, and child protective services must unite forces in early intervention efforts aimed at shielding the child from harm and extending appropriate support and treatment to the caregiver and the entire family unit. This delicate situation underscores the critical importance of swift action and comprehensive support structures to safeguard the well-being of the child while navigating the complexities of familial dynamics and psychological intricacies at play. Distinguishing between somatic symptom disorder and conversion disorder hinges on clinical nuances. Somatic symptom disorder unfolds as a tapestry of persistent physical symptoms traversing various bodily systems, ranging from cardiac and neurological to pain and gastrointestinal complaints. Despite normal medical test outcomes, patients often grapple with heightened levels of worry, anxiety, and depression tethered to their symptoms. In contrast, conversion disorder presents with a distinct profile spotlighting neurological symptoms like blindness, numbness, paralysis, and psychogenic non-epileptic seizures. These symptoms emerge abruptly, lacking a clear medical explanation, and may appear disproportionately severe in relation to their underlying causes. The crux of differentiation between the two disorders lies in the focal point of the physical symptoms. Somatic symptom disorder casts a wider net, encompassing a spectrum of somatic complaints across multiple bodily systems. Conversely, conversion disorder showcases a more refined palette, characterized by specific neurological manifestations, underscoring the intricate clinical landscape clinicians navigate in their diagnostic endeavors. Epidemiology and risk factors cast light on the multifaceted interplay of biological, psychological, and social factors contributing to the tapestry of somatic symptom and related disorders. Underlying neurological conditions or brain abnormalities can emerge as pivotal contributors, particularly in the realm of conversion disorder. Stress, trauma, and various psychological stressors weave a complex web, strongly associated with both the onset and perpetuation of these disorders. Insights from research hint at a familial predisposition, suggesting that individuals with a family history of somatic symptom or related disorders may traverse a heightened risk trajectory. This susceptibility likely arises from a fusion of genetic predispositions and environmental influences, underscoring the intricate nature of these disorders' etiology. Moreover, epidemiological data paint a gender-specific landscape with a higher prevalence observed among females. This gender disparity hints at the potential influence of hormonal dynamics and socio-cultural norms, sculpting the contours of vulnerability and resilience within diverse populations. Understanding the epidemiological landscape and risk factors surrounding somatic symptom and related disorders is paramount, illuminating pathways for targeted interventions and holistic approaches aimed at fostering healing and resilience within affected individuals and communities. Comorbidities and associated conditions intertwine with the intricate tapestry of somatic symptom and related disorders, illuminating the interconnectedness between physical manifestations and psychological well-being. Mood disorders, notably depression and anxiety, often weave their threads into the fabric of somatic symptom and related disorders, exacerbating physical symptoms and amplifying the overall burden of the condition. This symbiotic relationship underscores the imperative of addressing both the physical and psychological dimensions in therapeutic interventions. The specter of traumatic experiences and chronic stress looms large, casting shadows on the development and perpetuation of somatic symptom and related disorders. These adverse life events serve as potent catalysts, underscoring the imperative of delving into underlying psychological factors to unravel the complex tapestry of these disorders. Moreover, certain personality traits and disorders carve a distinctive footprint within this clinical landscape. Traits associated with obsessive-compulsive, borderline, and avoidant personality disorders have been identified as potential risk factors, accentuating the intricate interplay between personality dynamics and somatic symptomatology. Navigating the realm of comorbidities and associated conditions within somatic symptom and related disorders demands a holistic approach, one that acknowledges the nuanced interplay between physical, psychological, and interpersonal factors. By addressing these multifaceted dimensions, clinicians can forge pathways towards comprehensive healing and resilience for individuals grappling with these complex clinical presentations. Emerging trends and future directions herald a promising era of innovation and advancement in the realm of somatic symptom and related disorders, paving the way for more nuanced diagnostic approaches and personalized treatment modalities. At the forefront of this landscape, ongoing research endeavors in neuroimaging unveil the intricate neural underpinnings of these disorders. This deeper understanding holds the potential to usher in a new era of objective diagnostic tools, steering clinicians towards more accurate assessments and tailored interventions. Recognizing the multifaceted nature of somatic symptom and related disorders, there has been a paradigm shift towards integrative care models. These holistic approaches weave together medical, psychological, and social interventions, offering a comprehensive framework for effective treatment and support. Moreover, the digital health revolution propels us towards novel frontiers in assessment and management. Innovations such as virtual reality, wearable devices, and mobile health applications offer exciting prospects for enhancing the assessment, monitoring, and self-management of somatic symptom and related disorders, empowering individuals to take an active role in their care journey. As we navigate these emerging trends and future directions, the landscape of somatic symptom and related disorders stands poised for transformation. By embracing innovation, collaboration, and holistic care paradigms, we chart a course towards enhanced understanding, improved outcomes, and greater resilience for individuals traversing the complexities of these conditions.